This is Dr. Soumyakanta Das Pattanayak. Today we'll discuss about the heartburn and how to recognize the difference between heart disease and heartburn. So let's start and understand the chest discomfort, recognizing heart disease versus heartburn. So, what is chest pain? Both heartburn and heart disease can cause discomfort in the chest. Heartburn is caused by stomach acid rising into the food pipe, leading to a burning feeling. In contrast, heart disease can result in angina, including chest discomfort or a heart attack. So, which often feels like just tightness or pressure. It can be difficult to tell the difference between heartburn and heart problem, and even doctors in the emergency room sometimes have a hard time figuring it out. Every year, over 8 million people visit the emergency room for chest pain, and more than half of those cases turn out to be severe heartburn known as gastroesophageal reflux disease or GERD. After ruling out heart issues, if you are experiencing chest pain, it is important to seek medical attention to determine the case. So, when do the symptoms occur? Heartburn typically occurs after getting a large or spicy meal, whereas heart attack is more likely to happen during physical activity or in stressful situation or in any conditions. Heart, heart attack can occur in any condition, any situation, but heartburn typically occurs after eating a large or spicy meal. A heart attack shows certain symptoms such as chest pain involving tightness, pressure, squeezing, or stabbing type of pain or dull pain, usually in the center of the chest, or that is called retrosternal chest pain. So, and radiating pain that spreads to the shoulders, neck, or arms, heart rate changes, including irregular or rapid heartbeat, cold sweat or clammy skin, lightheadedness, weakness or dizziness, shortness of breath, nausea, indigestion, and sometimes vomiting. So, and on the other hand, heartburn is characterized by burning sensation or chest pain that starts at the breastbone and feels like burning, pain that moves up towards your throat but stays within the chest, and pain that moves up towards your throat but stays within the chest, not radiating to shoulders, neck, or arms. And reflux, a sensation that food is returning to your mouth, a bitter or sour taste in the back of your throat, worsening pain when lying down or bending over. Whenever in doubt, get help. If you are unsure about your symptoms, it is best to seek medical help right away. So let us understand the overlap between the heart and stomach. Acid from the digestive tract can lead to GERD, which causes heartburn or peptic ulcers that can damage the stomach or small intestine lining, creating painful sores. The main symptom is a dull or burning pain between the breastbone and navel. So, risk factor for the heart disease and stomach issues include both smoking, being older, and being overweight. Let us understand how modifications affect your heart and stomach. Aspirin is commonly taken after heart attack to prevent future issues, but it can also irritate the stomach lining. Clopidogrel is often prescribed with aspirin, and it increases the risk of stomach bleeding. PPIs are medicines used to treat GERD and protect the stomach from acid. Common PPIs or proton pump inhibitors include omeprazole, pantoprazole. Doctors may prescribe those for patients on aspirin or clopidogrel, especially if they have a history of peptic ulcer. When GERD is more common than peptic ulcer disease, if you experience chest discomfort during exercise that is not relieved by an antacid, seek medical attention. This could indicate a heart related issues. I have worked in cardiology setup, and I have diagnosed hundreds of cases of MI, and I have diagnosed thousands of cases of, and I have seen thousands of cases of GERD. Talking about the GERD, that is the GERD can be of two types, that is erosive gastritis or non-erosive type of GERD, that is called NOD. Both causes heartburn. So we have to be proactive. Any kind of chest pain, any kind of heartburn, or any kind of chest pain should not be taken lightly unless until you have not diagnosed. First, you have to think about the heart, and simultaneously you have to think about the GRT. First, you have to as heart attack can be life threatening or fatal. So first we have to rule, at least we have to do an ECG. If ECG is becoming normal, at least from the ECG, we can diagnose that yes, patient is having normal from the heart point of view, from the cardiology point of view. Otherwise, we can do TROP-T qualitative or TROP-I quantitative. That is cardiology part. After ruling out that, we have to diagnose it as GERD or not, and we should advise the patient to do a upper GI endoscopy, and accordingly, the most common or commonly prescription or commonly prescribed drug is proton pump inhibitor. And proton pump inhibitors are the first line of treatment in GERD along with other medications. So we have to first prescribe the proton pump inhibitors in GERD or NERD, and we have to advise the patients to take the food in less amount of food and in a frequent interval of time. Less foods in, not like you have to at a time you have to take much food, uh, huge amount of food. You have to take small amount of food in a frequent interval of time. That and that way we can also prevent GRD. So after eating or after having your lunch or dinner, you should we should advise the patient to walk for at least 10 to 15 minutes before sitting or sleeping. And dinner always should be before 8 p.m., at least before 7 p.m. or 8 p.m. And dinner always should be light, so that nocturnal GERD or nocturnal reflux can be ruled out, can be negotiated. Uh, so the most commonly prescribed drug in GERD is PPI, and we have seen in our practice different PPIs being used and different PPIs coming to the effect of negotiating GERD. And most commonly is used is omeprazole and pantoprazole, as discussed earlier. Thank you.